Hi, I'm Rebecca at Bodycraft Massage Therapy. In this video, I'm going to go through a self-lymphatic sequence that you can do. It's the fundamental sequence to help support your lymphatic system, and it's kind of the beginner sequence. It's what I do most days to help support my lymphatic system. You do not need to have a lymphatic issue or lymphedema to do this sequence, but for those of us who do have lymphedema or who are at risk for lymphedema, it is an excellent starting point in our self-care and maintaining a healthy lymphatic flow in our system. So there are quite a few things that we need to go through. The first are things to keep in mind. Top of the list, if you have an active infection, you need to wait until it is medically resolved. That is the safest choice, just to wait. You can always reach out to your medical team and discuss with them, but really we want to wait until whatever medications they've prescribed have been completed and you are symptom-free before we start moving a lot of lymphatic fluid. The second is if you have a heart condition where an increased fluid load on the heart would be problematic, definitely you want to speak to your medical team or speak to someone like me who's a certified lymphedema therapist to make sure that it's safe for you to be doing lymphatic work. Generally speaking, if your symptoms are well managed and you haven't had any acute symptoms and you're cleared to do things like exercise, this should be safe. But again, the safest route is always to speak with a medical practitioner. The third thing I want to talk about is the pressure that we use in lymphatic work. Whether you're someone like me who's a lymphatic practitioner or you're doing it for yourself, we want to be mindful of our pressure. Now, I am also a licensed massage therapist in the state of New York. I love receiving massage. It feels wonderful. It's very beneficial on multiple levels, and my body really appreciates it. However, if we're going to be doing self-lymphatic work, we want to be intentional about the structures that we're trying to access and how we're trying to support those structures. And in this case, we want to keep our pressure light. The classic cue is 5 grams or the weight of a nickel, because for the most part, the structures we're trying to access live between the underside of the skin and the musculature. So it's not as deep as muscle tissue. If you are doing a massage, which feels great, generally speaking, therapeutic massage, for the most part, is trying to address musculature or myofascia. There are always exceptions to that rule, but in general. So it's not a therapeutic massage. It's, while that is lovely, it's a completely different thing. So light pressure, because we're trying to, for the most part, stimulate the initial lymphatics or the lymphatic capillaries that are fairly superficial. All right. The other thing is, what body parts do we use to actually perform lymphatic work? And the answer is our finger pads or the length of our fingers. We're never going to really use our fingertips, especially if you have long nails. You want to be very cautious. You don't want to be poking into delicate tissue. If when you're doing this work, you leave fingernail marks, first, you're going way too heavy with your pressure. And the other thing is, instead of being on the pads, you're on the fingertips. So you want to scale back and have nice lengthened fingers. All right, which brings me to the next thing. Even with those lengthened fingers, it's easy to start having a little bit of glide. When we glide, we're starting to go back into therapeutic massage territory. So we're not trying to do therapeutic massage in this particular case. So we're not going to be doing anything that has a glide. So we're not doing effleurage or petrissage, which you might have learned from your practitioner, your massage therapy practitioner, or have gone to massage school yourself. All right. Next up is, what direction are we working with? So very often in a therapeutic massage, people will be working down the length of a limb, which is great for therapeutic massage. But when we're talking about the lymphatic system, it is not a circulatory system that's a loop-like system like the venous system, the blood system. It is a one-way system from the periphery or the distal areas to the heart. So lymphatically, all roads lead to the heart. And I'm going to say that a couple times as we continue through our video. All roads lead to the heart. So it's rare, it's incredibly rare that I would ever be working with my stroke down the arm. I'm always going to be up the arm or towards the center of my body. Because again, all roads lead to the heart when we're talking about the lymphatic system. All right, the next thing is, how are we going to stimulate the lymphatics? And for the most part, in a lot of the areas that we're addressing, we're doing so by stretching the skin. And that is because of how the lymphatic system is structurally. So if you think of your skin level up here and your musculature down there, that in between superficial space between skin and musculature is where the initial lymphatic capillaries live. Now, put that image aside. Let's talk very quickly about the initial capillary structures. They're like a simple garden gate, right? So here's our garden gate hinge. All right. From this gate, there is this beautiful thing called an anchoring filament. It's like a marionette string, and it comes from the gate and attaches to the underside of the skin. So if you pull the skin or stretch the skin, it pulls on that anchoring filament, again, like a marionette string, opens up the gate and allows for fluid to now shuttle from the tissue space into the lymphatic system, which is what we're trying to do in this work. So we want to stretch the skin, maybe 2/3 or 3/4 of the length of stretch your skin has, but not to the full extent that it could potentially stretch. And then we're going to make sure that we don't stretch it and then drag it back. We're going to stretch it however far 2/3 or 3/4 of the way is, and then we're going to let go and let the skin recoil. Right? Otherwise, it's like windshield wipers. We push fluid this way and then we push it right back. We want to push it towards the heart always. And then the next thing, which is the final thing, is that our tempo is going to be intentionally slow. We're thinking a slow waltz count. 1, 2, 3 to stretch, and 1, 2, 3 to release and let the skin recoil. All right. I am going to keep on my compression sleeve. I am at some point going to take off my compression glove when I get into the axilla, into the armpit, just so that I don't get deodorant all over my glove. But you can always do this as long as you have access to finger pads. Actually, when I get to the neck, I'll also take it off because I do want to be able to use the length of my fingers. All right. So whenever we're doing lymphatic work, we do want to start with diaphragmatic breathing because it does stimulate the deepest, largest lymphatic vessel, which is the thoracic duct. I think of it as the lymphatic superhighway. So if you haven't worked on diaphragmatic breathing, shoot us an email if you want a video on that, and we can always set up a video for it. But it's that nice belly breath. You see it in babies, you see it in animals. When they're breathing, their abdomen really moves. What I do want to be cautious about reminding us and reminding myself is that when we're breathing through with our diaphragm, we're not adjusting our posture at all. Our posture is going to stay nice and vertical. Now you can do this seated. If you're doing it seated, please, nice, sturdy, stable chair. This is not the best time to be using a rolling office chair or a rolling exam stool. You want to be something that's stable and grounded. You can also do this lying in bed. I tend to do this part of the series for the most part seated up because I get really relaxed and kind of sleepy when I'm doing it lying in bed. And before I know it, I'm in dreamland instead of doing my lymphatic work. So try it out, see what works best for you, okay? So we're going to start with the diaphragmatic breathing. We're sitting up nice and tall, shoulders are relaxed. You do not have to bring your hands to your belly, but I find that the biofeedback is really helpful for me. And we're going to remember with diaphragmatic breathing, as you inhale, the diaphragm muscle, which is here, is going to inhale and press down towards the pelvic floor, which will naturally distend the abdomen out. It'll naturally go out itself. You do not have to push your abdomen or your belly out. And as you exhale, you're going to think about hugging up the abdominal wall and staying as tall as you were the whole time, drawing your navel towards your head. And the abdominal contraction of the abdominal musculature will help the diaphragm spring back up towards the head, pushing the air out of your lungs. So that's our fast, down and dirty diaphragmatic breathing explanation. So hands on the belly if you choose to, shoulders relaxed, and we're going to take a nice breath into our abdomen. And full exhalation. Let's do 2 more. Inhale. Exhale. Inhale. And exhale. All right, let's get going. One more thing I forgot to say is the number of repetitions that we're going to do in each location. It can vary based on what you need it to be, but generally speaking, I do 8 to 10 when I'm at home. On my lymphedema side, I definitely do more because I do know that I get swollen in the axilla and the flank. So I'm going to give it a little extra time. So instead of doing 8, I might do 15. Whereas on the other side, where I don't have a lymphatic challenge, I might just do the 8. But for time purposes, we're just going to do 3 or 4 in each location. All right. So we're going to start at the collarbones. Find the collarbones and then find that little well just above them. And we're going to dip our fingertips in. If you have long fingernails, you're going to be careful that you don't poke in. If it's painful, you know you're a little too pokey, right? All right, we're going to find that nice middle spot, shoulders easy, nice and tall with a little bit of abdominal support. And we're going to drag the skin, we're going to stretch the skin really towards where the collarbones meet the sternum. 2/3, 3/4 of the way of the skin ability to stretch, stretch, 2, 3, and then lift up and let go, 2, 3, stretch, 2, 3, let go, 2, 3, and stretch, 2, 3, let go, 2, 3. So pretty simple, right? All right, let me take my glove off so I have the whole length of my fingers. The next is going to be the upper trap or upper shoulder area. And you may notice that the skin does not stretch as much in many of us on the upper traps because we hold a lot of tension there. It's more muscular than right here. So you're going to do as much as you can. Now you can do this both sides at one time. My shoulders don't love that, so I do one side at a time. And I like to stabilize my arm. If I'm doing this at a kitchen table or a desk, I will absolutely prop my arm up on the desk and then just move from the elbow. So in this case, I'm going to come here. I'm looking for that length and I'm going from the base of the neck towards the tip of the shoulder as far as that 2/3, 3/4 of stretch can go. And here we go. We're going to stretch, 2, 3, let go, 2, 3, stretch, 2, 3, let go, 2, 3, and stretch, 2, 3, let go, 2, 3. Pretty simple. Now the upper traps is an area where people tend to start going heavier and heavier because they've got a lot of tension there and it feels great to get into massage land with that musculature. But if you're feeling like, oh, the muscle's getting a lot of work, you've gone a little too deep, go back up to the weight of a nickel. All right, let's do the other side. Shoulders relaxed. And here we go. Stretch, 2, 3, and lift, 2, 3, and stretch, 2, 3, let go, 2, 3, and stretch, 2, 3, let go, 2, 3. Next up is the front corners of the neck. If you think of your neck as being a square length, then we'd be working on the front corners where the SCM or sternocleidomastoid muscle is. Now you can do this one side at a time. I like to do a little butterfly, fingers here. Now you're being careful you're not pushing back into your throat, which would feel very choky. Not trying to choke ourselves. And we're also being careful that we're not pulling down too hard. Again, ooh, that's painful. Just stretching the skin, about 2/3 of its capacity to stretch. And again, coming down to where the collarbones meet the sternum. Stretch, 2, 3, let go, 2, 3, and stretch, 2, 3, let go, 2, 3, and stretch, 2, 3, let go. Now I should say I'm using probably the first 2 lengths of my fingers. I'm not using my finger pads, but I'm really using a longer portion so that I get a little more surface contact. The same thing when I do the back corners of the neck. Again, you can do it both sides at the same time. My shoulders are pretty okay with that, but we're going to stay with the one side at a time. Yeah, we'll stay with one side at a time. Again, I'm going to support myself. I'm going to be thinking about using the length of the shoulders. I'm going from right below chin line towards where the shoulder meets the neck, right? And I'm going to go straight down with my drag and then let go. And drag, 2, 3, let go. I like the word stretch, so let's do stretch. 2, 3, let go. And we'll do an extra one here. Stretch, 2, 3, other side. And stretch, 2, 3, let go. 2, 3, and stretch. 2, 3, let go. And stretch, 2, 3, let go. All right, the next spot is just below the ears. Now you'll notice during high allergy season, most of us are a little puffy here. So you're gonna find the area that's, if you follow the angle of your jaw, just back a little bit below the ear, it's a little puffy, soft spot. You don't wanna push too hard because it will be painful. We don't need that. You're gonna use the first pads of 2 fingers, or you could do a little more, but 2 works for my brain. And again, drag is straight down or straight towards the pelvis. Light pressure, right? Stretch the skin down. 2, 3, let go and recoil. And down, 2, 3, let go. 2, 3, and down, 2, 3, let go. And then we're gonna reverse the locations we did. So now we come to the back of the neck. Stretch, 2, 3, let go. And stretch, 2, 3, let go. It's important not to hold your breath while you do this. Stretch, 2, 3, other side. And stretch, 2, 3, let go. And stretch, 2, 3, let go. And stretch, 2, 3, let go. All right, upper shoulder. From the base of the shoulder towards the shoulder tip. And remember, you're not gliding. Light pressure, stretch, 2, 3, let go. 2, 3, and stretch. 2, 3. I really lift up every time because otherwise my tendency is to windshield wiper back and forth. Other side. Stretch, 2, 3, lift up. 2, 3, stretch. 2, 3, lift up. And stretch. 2, 3, lift up. And now by the collarbones towards the sternal notch where the collarbones meet the sternum. And stretch. 2, 3, release. Remember, our pressure is light. If you're pressing really hard, your lungs are not going to be thrilled with it. They'll let you know. And one more time. Stretch. 2, 3, let go. All right. So that is the neck series. All right, the clavicular and neck series. Next, we're going to go to some deeper areas, which are the axilla or the armpit, the abdomen, and the inguinal creases. So with these areas, we do need to have a little more pressure because we're trying to get through tissue to get to the lymph node beds. When we're working in the axilla or the armpit, we want to think about the direction we're going. So we're thinking of a diagonal, like a raglan sleeve seam from the armpit, follows that natural dividing line between the pectorals and the shoulder. I'm going to have my fingertips up into the armpit, and again, I'm using the first 2/3 of my finger length, and I'm just doing a wave-like action, and I'm thinking about being halfway between the back of myself and the front of myself. So in our midline, from the side speaking. Now, it's almost like when you're pushing water, when you're in a body of water, like a pool or in a tub, and you're trying to make a current in the water. That's the same kind of thing we're doing. We're not poking with our fingertips. And again, if you have long fingernails, you want to be cautious that you don't poke yourself and create some inflammation there. So one side at a time. I do like to bring my arm up and rest it so it's relaxed and gives me a little space. And I'm going to go up towards the base of my head and release. And press, so it's less of a stretch and a little more of an intention of direction of flow. And one more time, stretch, 2, 3, release. Other side. Relax your shoulder and up, 2, 3, release. Try to relax your thumb. It's not something I'm great at doing, but I'm still working on it. Try not to hold your breath. Stretch, 2, 3, release. Great. The next area is the abdomen. So we're going to start where the rib line meets at the xiphoid process and we go down just a little bit. So we're right in the center of ourselves. If you're up at that xiphoid process, it's gonna hurt. Don't push on it, go down about an inch. And we're gonna have flat fingers and we're thinking about scooping in and up. Do not do this right after eating. Wait an hour or maybe 2. Otherwise, your stomach is not gonna be thrilled with you. All right, tall, shoulders easy. Here we go. Up, 2, 3, release. I will say that the abdominal work is easier to do inclined or lying all the way flat on a bed, maybe with your knees bent, because your abdominal musculature is not supporting you in a vertical position. That's okay. Next is the belly button or umbilicus. You're gonna come right to that navel and same thing, in and up and relax. Now I do find this is harder to keep my shoulders relaxed in this one, but keep reminding them. And my pressure is a little deeper, again, using the flats, not poking with my fingers, because I'm trying to transmit my pressure gently past the organs to the thoracic duct, which lives behind them. Let's do one more. All right, I'm gonna scoop back a little bit so you can see a little better. Next up are the lumbar trunks. So it's like an inverted Y, right? So here would be the stem, and this is where they go right and left. So you can do these at the same time. I like to do them one at a time. We're gonna come from the navel towards the hip crease. That's the diagonal we're doing. And I like to overlap my hands. And I'm coming towards the navel, which then would come up towards the heart, right? All roads lead to the heart when we're talking about the lymphatic system. 1, 2, 3, release. Now you can do this straight on your skin. I think it's better to be straight on the skin. And I'm trying to let my abdomen be relaxed, let my belly muscles be soft so that I can actually get deep enough. All right, other side. Again, navel, hip crease, draw the diagonal line, and then that's the direction we're going. Up, 2, 3, let go. 2, 3. Up, 2, 3, let go. And up, 2, 3, let go. And then we have our inguinal crease, which is the hip crease. Now, I'm gonna bring my soft fingers in. Again, I'm not poking with pokey fingers. I'm just softening into the crease. And I do take a tiny bow towards that knee, just so that I can soften my hip flexor. Same thing, just like with the armpit, I'm scooping up as if I'm coming towards my navel. Gentle pressure, up, 2, 3, release. And if you notice, like I did this last time that was a little pokey, soften your pressure, less fingertips, more finger pads. Now let's do one more time. Easy waltz count. And I'll do the other side. And again, I like to take a tiny bow just to soften the hip flexor. Wiggle if you need to. Up, 2, 3, release. And up, 2, 3, release. 2, 3, and up, 3, release. And we're gonna retrace our steps just like we did with the upper portion. So we do the lumbar trunks, release, 1, 2, 3, towards the navel, release, 1, 3, release, other side, 1, 2, 3, release. This is very calming. It is quite repetitive. So you may find you get very relaxed, kind of sleepy sometimes. To the navels next. In and up, 2, 3, release. In and up, 2, 3, release. In and up, release. Just a little higher, not at that xiphoid process. Up, 2, 3, release. Relax your shoulders. Try not to hold your breath. Be intentional about supporting your lymphatic system. And then I do like to do the axle again or the armpit again. Again, diagonal. 1, 2, 3, release. 1, 2, 3, release. 1, 2, 3, release, other side. And again, this is what we teach our clients here at Bodycraft Massage. If they need to do self-lymphatic care, this is the starting point. Now, when I do this on my own, it takes me maybe 10 minutes, once you get used to it, it's actually pretty calming, very quick, doesn't take too long. And then I do like to finish with the collarbones again one more time. Release, and I'm reminding myself that all roads lead to the heart, that we're directing that lymphatic system towards the heart where it'll become part of the venous system. All right, I hope that was helpful. If you have questions, please reach out to us at contact@bodycraftmassage.info. Again, that's contact@bodycraftmassage.info. Thank you so much. I hope you have a great rest of your day.